name's Sam Miller, and I'm a proud West Penn labor and delivery nurse. And the proud daughter of a retired 40-year West Penn nurse. I am here today for all the past, present, and future West Penn nurses. So, hello, West Penn nurses! I am so honored that you are all here with me today. At West Penn and Allegheny Valley Hospital, we are more united than ever before, and we are stronger than ever. And we are prepared to stand up for our patients.
Right.
We appreciate all the support from all the elected officials here today, as well as other union members, Allegheny General Nurses, Allegheny Valley Nurses, and Western Site Nurses. Your support shows how nurses and hospital workers across the region are tired of Band-Aid solutions and ready to lead the healthcare industry in a new direction. You may have seen in the paper, but we at West Penn overwhelmingly added our names to an open letter to Pittsburgh saying we will absolutely stand up for patient care. We are more united than ever before, and for the first time, nurses and hospital workers at 2 Allegheny Health Network hospitals have simultaneously authorized their negotiating committees to send a strike notice. By standing together as union members across 2 hospitals, we are stronger, and we know that by uniting across AHN, UPMC, and all over the region, we can transform a whole industry.
Yeah.
We may work at different hospitals and care for different patients, but we all recognize that we are a turning point in the healthcare industry. So what does that mean? That means we have a decision to make. We can back down and accept that nurses are going to keep leaving the bedside, and that our hospitals will be staffed with new nurses and travel nurses. We could back down and accept that big corporate healthcare systems will prioritize expansion of profits over patient care. And we could back down and accept that hospital industry will continue to fail its caregivers and patients. Or we can stand up together for our profession and our patients. So what are we going to do? Stand up or back down?
Stand up!
Stand up or back down?
Stand up!
That's right. We are united for our patients, and we are determined to turn the corner in the nursing profession. NHN's proposals do not go far enough to invest in senior nurses, to control healthcare costs, and they do not address the causes of nurse burnout. AHN must make major investments across the entire workforce, just like they did at AGH. Investing in nurses means investing in patient care and investing in our communities. We don't want to strike. We want to care for our patients, but we will do what it takes to stand up for our patients, our hospital, and our profession. More scraps?
Let's move!
More scraps?
Let's move!
We stand on the shoulders of working people who built Pittsburgh, like my dad. And now it is our time to carry that forward. And I know we have what it takes. Now I'd like to invite Representative Latasha Mays to the stand.
Give it up for the West Penn nurses, everybody. West Penn nurses, are you ready to fight?
Yes!
I can't hear you. Are you ready to fight?
Yes!
Are you ready to win?
Yes!
Are you ready to win?
Yes!
Thank you so much for having me today. My name is State Representative Latasha D. Mays, and you are all standing in the heart of the 24th Legislative District, which I'm so proud to serve in my first term, everyone. I'm the first woman to represent the 24th Legislative District. And I know what it means to value women's work. And so, we think that in industries that women are predominantly working in, that it is okay to disregard the work that we do every day. We cannot no longer accept, the inequity and the disrespect and the inhumanity that comes with not being paid the wages that you deserve. Am I right? We just celebrated Labor Day, right? So to me, Labor Day is every day. And it is women who have built the labor movement. And it is women who are going to fight and stand up, and they're going to win a fair contract for the work that they do every day at West Penn Hospital. We do. We do. We love all of our nurses. We love all of our nurses. So for me, what West Penn has meant, it is not only one of the multiple hospitals in the 24th Legislative District. It's where I've received care over the years. It is where my daughter was born last year. So I want to see West Penn thrive and be successful because it is important to our community and it is important to my district and the constituents that I serve and that these nurses serve. But we can't be successful and West Penn can't thrive unless they pay their nurses. West Penn is where you work. West Penn is where you serve. West Penn is where you care for the sick, the hurt, and the vulnerable. And I've said this to West Penn nurses, that you all are the backbone of our medical system, our healthcare system. Without you, we do not have healthcare in this nation. You deserve livable wages. You deserve livable wages. You deserve same staffing ratios. You deserve to be free from workplace violence. And so when I think about the work that I'm doing in Harrisburg, just a year ago, my colleagues and I, we started the Pennsylvania Black Maternal Health Caucus. And let me tell you why. Because Black moms are 2 times more likely to die before, during, and after childbirth. And some of you may be wondering why that is. Some of that, a lot of it is about medical racism. A lot of it is about gender-based violence. A lot of it is about understaffed NICUs and OB/GYN units. We have to make the connection. We have to make the connection between the work that we have to do for those who are most vulnerable and the care that we give to our nurses by paying them the wages that they deserve. How is it possible that we have one of the most severe nursing shortages in the country, with 20,000 unfilled nursing positions? How is that possible? And at the same time, nurses in Pittsburgh are paid less than their counterparts in other cities. Can we make that make sense? Because why? We need more scrubs and less what? More scrubs? More scrubs? Patients from this community and from all over the region, they come here. New moms, they come here, they travel to West Penn to receive care, and they depend on the nurses that are standing behind me and that are here today to receive some of, they're at the most challenging part in their lives to get the care that they deserve. But years of health system CEOs and insurance executives have put profits before people and patient care, and they've created this crisis at the bedside. But it doesn't have to be this way. We can make sure that nurses get paid what they deserve. We can make sure our communities are cared for. We can make sure that moms can bring their children in the world. For Black moms, 92% of their maternal deaths are preventable. And I'm very clear that's connected to the staffing levels that we have in our hospital systems right now. So this is the first time that 2 hospitals are striking, y'all. 1,100 brave, visionary, courageous nurses who understand that this is not just about them. This is about the present and future of healthcare delivery in Southwestern PA, across this Commonwealth, and across this nation. And I just want you to know that as your state representative, as a mom, as a member of this community, I stand with the West Penn and Allegheny Valley nurses. You deserve to be paid living wages. You deserve to have the care that you need. You deserve to fight through your union and organize. And most of all, you deserve to win a fair contract. All right? What's the nurses? You ready to fight?
Yes!
What's the nurses? Are you ready to fight?
Yes!
What's the nurses? Are you ready to win?
Yes!
Thank you so much. I'm State Rep Natasha D.
Thank you, Representative Mays. Now I'd like to welcome our nurse colleague at Allegheny Valley Hospital up to share her support. Welcome, CK. Hi, everyone. My name is CJ Kawarta. I am a 10-year nurse at Allegheny Valley Hospital Emergency Department. Let's hear it for the West Penn nurses. We've been watching what West Penn's been doing, your press conference, your strike vote. You are all on the move, in the news and looking strong. I'm proud to say that ADH is right here with you. We held our own vote last week and overwhelmingly voted to authorize our negotiating committee to strike. And we are so excited to know that we are not doing that alone, but standing side by side with West Penn nurses. Our hospitals are connected. West Penn nurses and ADH nurses work together to stabilize and transfer patients to receive the specialty care they need. Whether it be ADH nurses sending our cardiac patients here to the cardiac cath lab, or West Penn nurses sending their TBI patients to our acute rehab unit. We share the dedication it takes to serve our communities. We share the resilience to ensure that we get the support we need to provide the care that our patients deserve. Nurses and hospital workers in our region are more united than ever. We stand at a turning point in a movement in this region to take back our healthcare system, and we will not back down. We do not want to strike, but we are ready to stand up for our patients and our communities if necessary. At Allegheny Valley, we deal with the same challenges you are all talking about. Units where only a handful of experienced nurses remain, revolving doors of new nurses, feeling like we can't be the nurses that we want to be, feeling like it's impossible to give our patients the level of care and attention that they deserve. We've spoken up about it, and we've been told big corporate health systems like AHN and UPMC just don't have the money for safe staffing. Even though union nurses at EGUs were able to win the level of investment we're advocating for now, even though AHN reported significantly increased income and revenue just last week, even though they have money for travelers, renovations, new buildings, and big salaries for people who work as far from the bedside as possible. Do we believe that health systems can't afford safe staffing? No! We do not buy it. So at Allegheny Valley and at West Penn, union members are united for our patients, and we are determined to win the level of investment necessary to keep staff at the bedside and protect our patients. We will stand up for our patients. We will modernize the nursing profession. We will change healthcare in the region, and to get there, we will move in lockstep with each other and strike together at both hospitals if we need to. More scrubs.
Less troops!
More scrubs.
Less troops!
Thank you. Thanks, CJ. Here at West Penn, we stand with the Allegheny Valley nurses and hospital workers. Next up, Mayor Ed Gainey. Thank you for joining us.
Good afternoon, everybody. How you doing? You know, first and foremost, I want to ask y'all to give a round of applause for State Representative Natasha D. May for the incredible work she's doing at the state level. Secondly, I want to say thank you. The reason why I want to say thank you is because without nurses, there is no hospital. Without nurses, there is no hospital. With a staffing shortage, there's no care. The only way we can show that we care is if we make sure that our staffing is appropriate. We should make sure that the best customer service that we can give our region is because we have enough nurses on hand to be able to provide the type of care so when their family members come there, all they want to do is say thank you. See, I understand it because mines are getting older. The ones that came before me are the ones that I love. And I know that when I go to the hospital, and I know when I'm talking to people, a lot of times it's not the doctors, it's the nurses. A lot of the times it's the nurses letting me know what's going on, letting me know what they need, letting me know what I should be trying to tell my loved ones so that they are listening to the nurses. So the ones that care, I'm not saying the doctors don't care, they do their thing. But when it comes to love, compassion, and making sure that every day our customers, our patients are living in a way that is satisfactory and getting healed, thank you to each one of you nurses. And it's never easy to make a decision to strike. It's never easy, but always necessary. Always necessary because at the end of the day, sometimes the bargaining table don't always work. But they understand when you're not in the room. They understand when you're not providing that level of care that only you can. They understand why they need you then. And so we got to do what we got to do to ensure that you're okay during the strike. And I can promise you elected officials will back you, support you, and be there with you during your fight for what's right so that we can make sure that we have that the party's right, and that everything that we work for is in your hands and we're with you. See, that's what the power of togetherness looks like. No one should ever question your devotion. You show your devotion every day. Every day. You understand. And you still go to work with a smile on your face. You still greet the families and the patients with a level of care that lets them know that they don't have to worry about their loved ones. And so for that, I say thank you. For that, I appreciate you. And I know a lot of times you don't hear that, particularly in the hospitals when everybody's going through something with their loved ones. But I want to tell you today that we're here for you. We will fight with you. We will make sure that we don't just talk about it, but we walk the walk that you need to see to know that you're not alone. So you know my classic type. The ones that go get it. The ones not scared to go get it. The transformational leaders. The ones that made it for you to be here today. We got to make it better for the ones that come tomorrow. And how do we do that? We stand up. Because when we fight, we win. When we fight, we win. Oh, come on, they can't hear you. I said when we fight, we win. Let's do it again. When we fight, we win. Let's go get it.
Thank you. Last up, I'm proud to invite my longtime colleague and friend, the legendary Helen Huber.
All right, how's everybody out here? My name is Helen Huber, and I am a senior OR nurse. In hospital. Guys, I've been here 52 years. And I'll tell you something. This hospital educated me, helped me raise 3 kids. Okay? And I have such great memories that I'm making every day. And I have made at West Penn Hospital. I have a lot of respect for this hospital, guys. I respect the culture here. Our standards are very high here. We are committed to the patient. Okay? What I say, the patient. Right? All right. the high-risk babies. That beautiful child down there. We take care of that child. Beautiful high-risk babies. We take care of burns. We're the second burn hospital in the city of Pittsburgh. We get burns as far as West Virginia. Comes into our burn unit. We have robotics. Everybody heard about the robotics, you know that. West Penn's leading the way in the robotics. All right? We are truly a family, a real family. I'm not fighting this hospital. I'm not fighting my managers. What I'm fighting for is the patients. Are you fighting for your patients? We need big health corporations to invest in retention. Okay? Recruitment. You know how many nurses we need? We need to recruit some more. We need to keep the ones we have. And we need safe staffing. Healthcare is not a machine. Folks, we don't work at the car dealer, right? It shouldn't be about, I got something in my pocket, where did I drop it? I got this $2 bill. I don't know if y'all have seen the $2 bills lately. But healthcare is not about the almighty dollar. Healthcare is about our patients, our mothers, our fathers, our children. That is what healthcare is about. And guess who knows the best thing about healthcare? Who knows the best about the healthcare? Who knows the best about the healthcare? Right. So that suit that sits in the office and thinks he or she knows more than we do. I got a secret for you. Don't come to West Penn OR and think you're not going to meet Miss Helen. Because I'm going to be waiting on you. We nurses know more about healthcare than anybody else can know about healthcare. And you guys know that. You can look at your patients and know that. And that's why our families depend on us, to make sure we take care of them. All right? Together we are powerful. Look at the nurses. Look at what the nurses have accomplished in this city. Just look at it. Nurses are crossing hospital lines. Nurses are crossing health systems. We are uniting. That's something that the suit didn't expect to happen. Allegheny won the first staffing protection in the state. They won strongest pay, not just a little bit of dollars. They won money. Lots of money. All right? And we at West Penn and Allegheny Valley are going through that door, and we're going to get some of it. We're after it. We're not backing down. Are we backing down? Backing down? Right. My vision, and all of my nurse friends here vision, is that nurses and patients unite across all the hospitals in this whole region. Okay? And when we do that, think about it, folks. When we cross over to every hospital in this region, think how powerful we will be. Okay? A man had a dream, but we nurses, we got our dream too. All right. I want to say one more thing to you guys, and it's a question. Are we united? Yes. Are we strong? Yes. Are we
representatives for Senator John Fetterman and Controller Corey O'Connor, and the other unions here, SEIU 668, SEIU 32DJ, and Unite Here 57. We appreciate your support. We are eager to quickly reach a contract that meets the needs of nurses and patients, and we'll return to the negotiating table with AHN. But if no agreement is reached, nurses will be together again in 1 week to vote on setting a strike date. That final strike vote is Wednesday, September 11th. Every nurse should register for a meeting coming out of this rally. Stop at the sign-in tables to register. And if you're a non-union hospital worker and want to stand with us, please go to standupforpatientcare.com. Thank you, everyone, for coming out today. Who's got the power?
We got the power.
What kind of